Had a little lamb.
Oh, do you guys have the other tests? Cause I can.
I do.
Okay.
I grabbed them.
I don't wanna make you guys do them all, cause it seems fun.
It was. Oh yeah, if you got your grade into the grade book, don't panic yet. We don't have all of them in yet.
Yeah, pretty only one in there and someone I failed. That was a big jump scare though. I know, I thought I went, oh my god. I was like,
On the bright side, one of the exams got lowered even more to like a lower percentage, so.
Is it the one that was like confused between like the 70 and the 62?
Yeah.
That one?
Uh,
So the last one? No.
So, you all are getting a little bit extra points regardless of.
Are you going to? Extra methods behind.
Yeah. Today, yeah.
Okay.
Are you not
I'm
going?
not.
Mary,
I'm not
going.
Yeah,
I'm not going.
Neither am I.
It's just the review now.
Oh,
please
please
go.
go, send us the notes.
I feel like the other class is so much easier to study for, because it's literally just like definitions.
There's 4 Zooms for this unit, and one of them is my presentation, so.
Oh, sweet. And you know, he's gonna like, for once, he's gonna actually include like things from your presentation into the test that go like,
You did last time.
Mhm.
That's was.
Yeah,
I
what?
sent you my whole list of notes that was from the presentations.
Oh.
anyway,
Okay.
this class. Did you guys go over serotonin? Cause I'm just picking up in my notes.
What about?
The pathway. The trips, yeah, yep, okay.
That'll be-
I'm just going through my notes from where we left off
Same.
last time.
Same old. Yeah.
Okay,
Yeah.
I know he's talking about meth the one day we were in. Yeah, and like
Did
we
you show up to that class?
just showed up that one day.
And how he like knows how to make meth, knows how to.
Yeah, he taught us how to make heroin last semester.
Oh, he's like advertising it.
Yeah.
It's like, oh, you know, this, it's like, I can't remember.
Okay.
I made a side by side of him and Walter White.
That's right, I lost it. Okay, so serotonin, and then acetylcholine.
What exam is this?
Right.
I'm just gonna plug this. Yes.
That's what you
Yes,
can do.
that's pretty calculated.
And then it looks like there's some stuff about.
Neuroleptics,
So there's like mimetics in here,
mimetics, neuroleptics.
and then neuroleptics, and that's what he was going off about.
Yeah.
Last, like, yeah.
Adenosine GABA.
Yeah, Gavin glutamate, and then VA. That's in calcium.
So.
GABA being glutamate. Okay, well, I'm gonna start doing the fan into that right now.
Yeah, I can give like ad libs. I'll be the. This is the one I just,
Like the, you think they'd like fold it.
I feel like I should get a haircut, but I'm like, I'm too deep into the
It works.
haircut line.
I think it works.
Actually, yeah, I don't really like that they have.
It looks
like,
overgrown,
Yeah,
but not in like
laughing at us.
a bad way.
I was going to grow it out so I could put it up into a bun,
I
but
can see that.
it's been so long and it's just not growing, so I'm like. And it's at the bad point where it's like, it's too, it's in between.
It's in between. I can see you with a man barber. I think that would work.
I used to have one, yeah. I know it used to be like
No.
down here.
I used to have a pixie cut. I used to have like short hair, so I know.
I could see that.
I probably will be.
It was a time.
This summer, I'm gonna-
I also have long hair, and I'm glad I don't. It looks like a lot to take care of. You should wear your shirt. Yeah. And my hair gets so much faster when it's like really long, so.
I like shower every day
As you should.
and my hair gets really dry. But I don't like this morning, I don't like I feel disgusting.
And like, I have.
Rad.
I have an industrial.
Yeah, exam 5.
They're like a little bit, because we did serotonin and acetylcholine on our exam.
Yeah. So,
So there's nothing pulling up on your Quizlet for tryptophan.
yeah,
That's
that's,
4 for us.
Okay.
yeah, they didn't cover over serotonin yet, but we'll go over it now.
Okay.
Also, a big recommendation, if you guys see more extra credit opportunities to like show up and just like do one of those tests, do them. They're so easy.
What test?
So like, I don't know, I saw a few announcements where it's like, certain person needs more participants. If you show up, you get like, I don't know, 2 points extra credit, I think. They're really easy. You just like email the person, you're like, hey, can I show up? And they're normally like, yeah. And then you just show up and then you get to do like a brain test. I did 2 when I was in the class. The one that I did was something about like ADHD, which I don't think I have, but I mean, why not? I don't know. And it was really funny because one of the tests that they did was they had us like play a game where we'd like throw the ball around people and you're supposed to pass it as soon as you got the ball. And then at one point of the experiment, it would just be people passing the ball between each other and they wouldn't throw the ball to you. And then at the end, it would be like, how did you feel? And then you're like, okay.
I did like an online simulation of that last year where it was like online people passing a soccer ball and they weren't passing it to me. And I was like, okay. How does that just make you feel? Were you sad? And I was like, not really. They're online people, so my feelings weren't that.
Yeah, so they are like really, really easy little fun things that you have to do. I mean, like honestly, it might take 30 minutes out of your time and
We did this.
it's
We did,
extra
we
credit.
did. This is the
Like,
tryptophan.
We'll definitely go over that.
Yeah.
Yeah,
Tryptophan pathway.
that's the only thing I know.
You will need to tell your other classmates to show up because some of these tests I'm grading and they're like.
You can tell who just like knows the stuff, who shows up to the study sessions and who doesn't know it and
I
doesn't
don't
show
even
up to the
know.
study session.
I will give you extra credit if you put anything on the extra credit page, and one kid put, don't know their name, he put, what did he say?
We're not good to leak it either.
He said, I have a fear of staircases because when I was little, I used to have shoes with heels in the heels. With wheels in the heels of them.
Oh,
And I said, cool, and gave him the 6 points. But it didn't push him over passing, so I was like, whatever, might as well.
Yeah,
So,
I've seen a few rough exams and you can tell that they didn't show up. But
I'm wondering.
I mean, I will 1000% say that the people who show up, even if you're like, God, I did so bad, I got a C, trust me, you're doing good.
Well, thanks, guys.
That's so
That
rich.
makes us
Not-
feel better.
Cause
So
like,
Bob Lloyd, I'm not doing well, so.
you're doing better.
Doing better,
Like, look, even if you get a C,
sorry.
it's a tough class, so
No, it's hard.
C's do get degrees. That's my motto. Shouldn't be.
C's get degrees.
Oh, they do, they so do.
That is so reassuring. Some people I look at them in class and like.
I wonder, are you failing or are you?
Most people don't get A's in this class, so.
That makes me.
Yeah.
I got an A on the last one, I told Bob to frame it.
Frame it.
Put up on a screen.
It's like, put it up in your office, this is.
It's gonna get.
One is a lot.
There's no wall space in the
Put it
office.
up on the office, I mean, I walk in there and there's like the exams on the floor.
I asked him for an extra yellow folder so I could put the first exams. He handed me this off of the floor. No, he handed me this one off the floor. It's just covered in scribbles and just destroyed.
I already turned in my manila folders back to the thingy. I have them right here, though. I mean, if you want, Ronald, you can.
I haven't even
steal
touched
it.
I'll just steal some off.
Kayla and I
But-
walked in.
Did you take
to
the
our
rest of them?
test, like, so we could look at them.
Uh,
So there's-
I
it
took
literally took him like 20
my
minutes,
third,
20 minutes.
went home, graded
It's like
them, and then I came back this
yeah.
morning,
And it's
swapped them
probably-
out, and then I was like, now I have all.
I haven't even touched mine.
So concerned that that.
I mean, it's
gonna, like, get to their-
I want to.
Okay, so, okay, I figured that you would, so I didn't do them all, but
Put them in the grade book. So you should show me later. I don't know what I'm doing.
Okay, I think this is all done.
looks good.
So we can just go over this like we have in previous times. One important, I'll talk about it later, actually. So tryptophan, and then the enzyme tryptophan hydroxylase, which does,
Hydroxyl.
yes. And there it is, and that's the 5th carbon, and so it's 5-hydroxytryptamine, that's what the 5 means there. Yeah, and so it's the same as tryptophan, but just hydroxyl group on the 5th carbon. And then amino acid decarboxylase, because amine, acid, amino acid, pretty intuitive. And so it removes the carboxyl group. I trust that you guys get enzymes now, so. And so, again, same as tri-5-hydroxytryptophan, but no carboxyl group, and so this is just 5-hydroxytryptamine. And so just thinking that like, okay, now there's only the amine group, and you get this. And it's gonna be really important to know that this is 5-HT, and that it's 5-hydroxytryptamine, is the same as serotonin. I remember him asking a question about that last time, so.
About what, which one?
What is like the chemical, technical name of serotonin? And you'll wanna know 5-hydroxytryptamine.
If we wrote 5-HT, would we get enough points? Or just not?
I would give it to you.
5-HT.
Yeah.
Oh, yeah. Oh, yeah, put that.
Word.
Oh,
I just,
Yeah.
I'll give it to you too if you put 5-HT.
you're not going to class? You both are not going to class. I'm emailing Lloyd.
poor Bob Lauren.
Yeah,
Okay, I just wanna, for clarification, what's the difference between tryptophan and tryptamine again?
so, the only difference really is that tryptamine doesn't have the carboxyl group
Okay.
that tryptophan does have.
Okay.
And so when you think about the names, you can think like amine, it only has the amine.
Do you think in Alaska's, like, we talked about, how people with like bulimia, also depression, and like, they get a low protein, high carb diet from tryptophan? Do you think that's important to know?
Yes.
Yeah, that'll be important. And so because tryptophan has a hard time getting through the blood-brain barrier, they'll eat less protein so that there's less amino acids preventing it from going through.
So that's what, like, when they like binge per se on like high carb, low protein foods, because they're able to get tryptophan through the blood-brain barrier, they're able to make more serotonin, which makes them
Feel better, yeah. And so he's saying like subconsciously, people will have these like high carb, low protein diets because when they have less protein, more tryptophan gets into the brain.
Okay.
And so they're producing more serotonin.
Okay.
Yeah.
He loves Dr. Steve.
He's gonna eat this up.
He does love
No,
Dr.
oh my, this is so off topic. I went into his office and told him about the grad class and how it didn't go through for me. And he goes, have you asked Laura if hers went through? I said, well, I did, but she hasn't responded. And he goes, is she mad at you? I don't know.
The registrator.
Yeah.
Registering in that very moment. What? So I was probably registering in that very
Real.
Yeah, I have to get enrolled in that class too.
Yeah.
I can't, I was like, I told him, I was like, hey, you have to like enroll me in the class. He goes, how do I do that? I'm like, you're the professor.
That was
so funny.
It'd be like professors and was like, do you know how to do this? I was like,
Yeah.
no.
So I went to Keith Young telling this and he was like, how do I do this? And he was like, well, the instructor needs to send out a message. And he was like, well, who's the instructor?
No. During my lab today, he gets up in the middle of it. He goes, I have to go yell at my colleagues and
Yeah.
just leaves the class.
He goes, I have to hydrate and leaves for like 10 minutes.
I love that.
Yeah, he was sitting there for like 15 minutes, like, what the fuck, this stupid piece of shit.
Yep, yep.
So this is
I was like, during my lab, I'm like,
That's goals.
Yeah, it's always got some shit to say.
this is the serotonin equivalent to homophenolic
He's a
acid.
real.
That would be
Okay.
accurate for me to say.
Yes,
Okay.
yes, that would be. Because it's broken down my mouth, so that would be the byproduct of, yeah, that's basically the same thing, but for serotonin.
Okay.
I put us off.
That's okay. That's
I'm here to. I
It's
can't over this.
supposed to be my job.
The most recent.
So then-
Okay, no.
Okay.
Back on topic.
Yeah.
For the students who are gonna watch this later. Oh, sorry, this should also be like this. Okay. So then, like how dopamine gets broken down into homophenolic acid, there's a breakdown product for serotonin after it gets released into the synaptic cleft. So it gets released, MAO comes along because remember COMT doesn't affect serotonin because it's not a catecholamine. So monoamine oxidase comes over and oxidizes the amine. And then there's a rogue enzyme going around just hydroxylating things. I remember him telling us about that. And so when MAO comes along and oxidates serotonin, it gets turned into 5-hydroxyacetic acid, which is abbreviated 5-HIAA. The I stands for indole, if you're curious. This right here is an indole structure, so technically it's 5-hydroxyindole acetic acid.
Don't memorize the full name, just put an abbreviation, please.
Yeah, so 5-HIAA is the serotonin equivalent to HVA. And then this is serotonin. And yeah, you'll want to remember 5-HT and 5-HIAA.
What was the thing about the homovinylic acid?
Oh, it's just, this is the, like, what is homovinylic acid or what is it in relation to this?
What is it in relation to?
So homovinylic acid is to dopamine as 5-HII is to serotonin.
Okay.
Yeah,
Yeah.
so as dopamine gets broken down, it turns into homovinylic acid through MAO. And so that's like, you can measure how much dopamine is being like produced in the brain based off of like your HVA
Yeah.
breakdown and spinal tapping it. And I guess you could do the same thing with serotonin with like the hydroxyacetic acid. So just in the same way that like you can measure your dopamine production levels through HVA, you can measure your serotonin levels via HIAA.
Okay.
Sweet. Do acetylcholine?
If you have other questions, let me know. I'll try my best.
And then you'll have me.
Yeah, I'll just.
Dance moves.
At least for this.
Contribute that in some section.
Yeah. You just write down what dance moves he's doing.
I'm here to be Ben White today.
If you draw him dancing in extra
I'm
credit.
retired from being.
I feel bad, I'm so lenient with extra credit, I barely read it. Like,
I'm like, that's about characters.
Right, I'm like, yeah, you reached your character limit, no, I read it, but honestly, if they're like not doing well, I just.
That's like so bad though.
As long as you
Don't
put
tell that to
something
us.
down and then I'm like,
Don't.
okay,
Right,
I
that's
can
like-
understand.
I understand where you're getting at. Sometimes y'all put something instead in class, and it makes no sense, and I'm like, I just assume. You're like,
That's
I-
where
Yeah.
like,
More people drew banana, it said banana all.
yeah.
There you go.
Yeah, I
Yeah.
agree. Oh, I wasn't here.
All four of them.
All four of them.
Yep. Because it's not a catechol. So the C in compt is catechol, and there is no catechol here.
What would you call this kind of?
The
Yeah, give it a name like that. I'd say like
serotonin pathway.
Serotonergic pathway.
serotonergic was fancy.
Ooh, serotonin. Did you go over the martiniergic thing with you guys?
I think so.
Yeah.
Yeah.
Okay, so like I get that the 5-hydroxytryptamine, that's serotonin.
Mhm.
Would you say like how does like the MAO play into that? Is it like an extra step? Because you already have serotonin created.
Yeah, so serotonin is created, released into the synaptic cleft. And remember, there's two ways of turning off synaptic communication, reuptake and enzymatic degradation. This is enzymatic degradation.
Okay.
So this is like the natural process that would occur in the brain to like break it down.
Yeah.
I guess if you think of something like an SSRI, like Prozac or other like antidepressants that like are a serotonin reuptake inhibitor, that's one way that like, you know, it reuptakes the serotonin, kind of allowing for more. I think, what was it? How did he describe it as? Which one was it? Did you guys go over agonists and antagonists?
That's the worst.
Oh, yeah.
Ever.
Did you guys go over autoreceptors yet?
No.
It's an indirect agonist.
Yes.
Oh, yeah, indirect, okay, that's what. Yes, it is an indirect.
We'll get to that. But just to like prime our minds.
And then you
for it.
guys did talk about the acetylcholine pathway?
Yes.
Okay.
But we should talk about it.
Yeah, we will.
You should do it.
Am I good to erase this now?
No,
Okay.
yeah.
Whoa,
I took a picture of it.
Yeah.
Okay, I want one.
I did send it in the.
I've already started the like review page.
Okay.
Kyle's making up for it in this last year.
This is like-
Review.
Yeah, this is my makeup.
Yeah. I was just gonna let you retake the test. Oh, I talked to Gilbertson today as well. I'm gonna take my quiz earlier in class tomorrow so that I can leave for proctoring.
Okay.
Okay,
So-
I can do 1 to 2, but then I have to work, so. Or,
12 to
no,
1?
12 to 1, that's
I
what
was like.
that's what I meant. 12 to 1.
Okay, yeah. Yeah, and I'll be in there at 1, my class.
Okay, sounds good.
Okay, you can erase this. or
Okay.
those-
Hated that class. It's done in the past. Thank God.
Yeah, I forget what class are you gonna put?
That's what I think.
It was good, but it's like his tests are hard.
So we didn't have it until then. so-
It's-
My friend's in it right now, and she's just been like,
I did really good.
okay, well.
Yeah, I know.
In the
I was
class.
excited.
I got like a
Still not
92.
excited.
I think I had like
Yeah,
a 1 or a
that was
92.
22.
I had like a 94 and then I took her final and I got higher than a 94. It's my grade still dropped. I'm so bad.
I was like writing down the robot. Robot.
I don't remember.
I don't know, that's the two, don't take it, that's so long.
They did like the corrupt.
I should feel like,
But I don't.
you take psych of one.
Oh, and you went all about.
I remember that people die before they get.
Keith Galen?
Yeah.
That's
No.
That's the one.
That
thing
was
I
one
have.
of them on the last exam, I was like, I remember that one.
Messed up my research so.
Or the one that we just created.
She's like, no, at all. Yeah.
And
His lecture, it's like literally one word definition, two word. And you're like. Basically. But like not even helpful.
Okay, but I'm taking an interesting class, so maybe it'll.
We're talking about schooling right now.
I'm taking an interesting class. so maybe
I
it'll-
took cognition or. I also know people that took cognition with me. Crazy about it. So it's not.
I just learned A. I just read. I guess it's not too late this year.
Oh, Lord.
I love Hungaro talks and.
Like,
Just-
Oh,
word.
that is-
I like.
Like it's choline and acetic acid when they come together and they have like a little bridge.
Oh,
that
yeah,
lines-
the
That's
acetic
the whole-
Yeah.
Combination of the names.
That's the whole thing.
Okay.
That's a good way to describe it. Oh, we can, because you put them together and.
They come together, they do their little thing, and then they separate, and then choline is inactive, so then it has to rebind with the acetic.
I don't-
It goes into the.
No, it's-
Okay, that does it again.
So much more
But it
sense than what you
also-
said.
It's
You put them together,
Right.
it's just their fault.
Because what I believe said,
Yeah.
Okay,
Totally.
start
all
with
right.
choline and acetic acid, then you end the same things. What's the point of the whole process?
No, it is.
What if and acetic acid, they can't do things.
Yeah,
like
acid
that,
and then
you can
is
do-
involved
You
in
need
it.
the same choline for
Or
certain things.
Oh.
beehives.
Put them together,
That's
and then
nice.
you
I did
get
not
the
know.
cycle.
True.
And so.
So it's like
It
a
is
rental car.
involved.
If you're renting a car, so you can go do things.
Oh, I remember that.
Okay, wait, what? did
I remember-
you say?
And everyone else will come.
Oh, they set up as.
No, it's what? It's like needed for some processes.
Yeah.
It can't be cool.
Okay.
You can ask them, I wouldn't know.
Did he talk about acetylcholine being a transcription activator?
No.
Okay, never mind.
What is that?
Basically, it means cell growth happens if it's around.
I think that's what it means.
Okay.
That's probably not.
Okay,
That's
that's
a
fine.
little.
He doesn't discuss it. Just random shit.
That's what.
If you memorize how to make heroin and put it in the extra credit, you'll also get full marks. That would be amazing. Please do that. That would be funny.
So we have Lloyd markers in here apparently.
Yes.
Were you in class when he drew on the board and nothing came out?
Nothing came out, and then you
And
had
he-
to run to get the other.
And then he goes, imagine it.
Yeah.
I was like, okay, so this is acetylcholine right here. And when you have acetylcholine, gets released into synaptic cleft. Enzymatic degradation via acetylcholine esterase breaks it down. Acetylcholine is just made up of two words, choline and acetic acid, right? So it gets broken down, brought back into the bouton, reuptake right back into the Bhutan. And there's an enzyme in the Bhutan, choline acetyltransferase, which transfers acetic acid to choline to make acetylcholine.
So
Again,
philosophy
like
right
this,
there.
this makes no sense to me.
Okay,
I feel like we never even talked about the choline acetyltransfer. did we?
No, we didn't.
We did.
so
Good.
first off with ester, so there's an ester bridge right here. So an ester bridge is like,
We have. Choline.
so this is an ester bridge right here. You have a carbon, and then you have a residual, and then there's an oxygen, and then a residual, carbon, oxygen, residual, carbon, residual. So acetylcholine esterase comes in, breaks these apart, giving you choline, because if we look like to this side, you have choline here, and then you have acetic acid over here, CH3, carboxyl group, and then over here you have choline. When this gets broken off, there's a hydrogen that gets added here because hydrogen is kind of like a space filler atom. And so it gets broken apart. This enzyme breaks this bridge right here. And then in the synaptic cleft are these two molecules, choline and acetic acid, right? Acetic, choline, that whole thing. Then the Bhutan sucks these back up into it. And then when they're in there, this enzyme, choline acetyltransferase, glues them back together to give you acetic acid for the next time it fires out. So this enzyme turns off turns off synaptic communication by just snapping it apart. And then this one prepares those parts to be sent out again.
Do you all know what an ester bridge is?
Yeah, but doesn't it have a double oxygen on the carbon? Cause then it would be ether if it did, cause you talked about how Eastern it would kind of similar, but it was very brief, I don't think something like that, but. it did have those.
Oh, yeah. Okay, hold on.
Go.
So, as you talked about ether, it looks like that.
So acetylcholine esterase breaks apart into choline and.
Just
choline
and acetic acid,
And then the choline.
and then brings them back together.
You could put it breaks, so acetylcholine esterase breaks the ester bridge in acetylcholine and produces acetic acid and choline. It just splits it into, it's two separate, like you said, it's two parts to its name.
Choline. So it snaps it in half. Sorry, so this is what it looks like more drawn out. So here's this ester bridge right here, double bonded oxygen, residual, and then oxygen and residual, oxygen, residual. Yeah.
So basically, it's like the purpose of this whole like choline bonded by an ester bridge to acetic acid is to create acetylcholine, because that's important for like the reasons you have right there.
Yeah, so we need acetylcholine for all of this stuff here.
Okay, and then the ones that like gets broken like by the ester bond, did you say it's choline that goes into the Bhutan?
They both get brought back in, I believe.
So
This- They both get brought in, but they're both inert because they're not acetylcholine, they're just choline and then acetic acid floating over here.
does that have like any effect, or is it just kind of like
They're both just kind of,
just there?
they're just there. And then this enzyme in the Bhutan brings them back together.
Also, it just kind of like repeats.
Mhm.
Oh, but.
Okay,
Yes.
so just for clarification, the choline acetyltransferase, that's what combines the choline and the acetic acid into acetylcholine. And then the acetylcholine esterase is what breaks them apart again to go back to just choline and acetic acid.
Yeah, hold on.
Okay.
So this one breaks it apart, and this one fixes it.
What's the deal with the arrows?
Yeah, they're kind of confusing. This is saying that. This arrow is saying that this enzyme turns this molecule into these two.
Okay.
And this arrow is saying that this enzyme turns these two into this one.
Okay.
And this is acetylcholine, but you can barely see that. Arrows are not actually.
When you would need a cholinergic drug. Yeah, like, would that be useful for you?
Well, we talked about succinylcholine. And so that would be a direct antagonist.
Dementia,
Oh,
glaucoma,
yeah.
those are probably the only ones I talked about.
I mean, also, I guess like you have just a genetic deficit of acetylcholine and you take a cholinergic drug.
Yeah.
Or you have to know anything about the alpha methyl paratyrase?
Yes,
Yeah.
yes.
Yeah.
Can we talk about that?
We won't be going over there. We'll go over direct and indirect agonists and antagonists, and then we'll do that because they kind of flow into each other.
Right, this is to say.
Isn't alpha-hydroxy?
It should be on Monday, the exam should be on Monday, like,
I don't think anyone that moved back 2 days in, that means this one has to be moved back 2 more days. Because it was supposed to be next week.
Back 2 days.
It is, we get pushed back 2 days.
I just need the weekend so I can.
If
walk
you
in.
email him and say, I don't feel ready, I'm taking it,
Make
put
it
it on
up
the
with
TA on Monday,
Make it
you
up with
could say
me.
that,
I have somebody making up an exam on Monday.
yeah.
Yeah.
Maybe I'll come with you.
It's happening.
It depends on the time, I'm kind of booked.
My Mondays are free,
2
so I think
PM
they'll
to
want.
5 PM. Monday is when I have my makeup session, so if you have it.
See you then.
I go to tutoring for math
I'm gonna take it.
at that time, so.
What class are you in?
Pre-calc.
When I was in high school, I never studied for my pre-calc tests, and I got a 3 out of 15 on one of the
Yeah,
language
no, my
sections.
first 2 tests were 30% each.
Dude, that's so bad. I was even literally only like college algebra and that one was.
I cheated my way through algebra earlier. So, if I were here, I cheated my way through.
Having to do so much homework, like
We didn't even talk
pages
about
of those.
this.
stupid
I gotta-
notebooks,
Yeah.
having to do
Take
like
it.
that.
You probably had to take it because you're a STEM major, but.
Do I have
Take-
to email the time? I went to the head of the math department and I was like.
Just let me
"This girl
know.
is not in effect."
And then they-
And let
yeah.
Bob know too. that-
Yeah, it is
I'm
effective.
so
You just
lucky that
don't
Bob is
worry
a
about it.
These are just
I'm like,
telling us to
"Okay,
just skip the time.
Yeah, I'm like, okay,
He doesn't have the time.
I'm paying you to teach me, I'm not paying.
I'm paying you to teach myself, plus $200 for an online text.
Seriously, that I literally don't. So, it's so.
What's next?
Probably indirect and direct agonists and antagonists. I think I'm just gonna draw like the.
Hey, wait, I'm making a review of all this, and then I'm gonna post it at the end of this.
We're gonna have
So
photos.
Whoever makes the study guide, the study thing, just take what I have, so you all have the same information.
Yeah.
Genius.
Uh-huh.
Or,
No,
You guys have this.
I can just send this to Dr. Lloyd and say the people want this to be used to make.
The people have
Study
voted.
guide.
The students have spoken.
The people have spoken.
Mhm. We
If
live in
we all
democracy.
bully him into it, he'll do it.
And by bully, you just have to say it like 2 times. He's like, okay.
Right, honestly, just be like, do this.
Don't we?
He doesn't care.
Extra credit though, if we go and make a study guide?
That's true.
Yes, so.
You can just copy paste if you have like digital notes, I've built this to people before, just copy paste them into there.
Yeah.
And so,
Yeah.
cause I remember Jackson had to do it. I was like, bro, just post your notes. He's like, that's a good idea.
I should have done that.
Okay. I think I can.
Yeah, you're good. I got
Oh, I'm
it.
gonna stop into his office 2 days so that I can get into my body collection.
Wait, can I go with you?
Yeah.
Okay.
He's gonna be like, why aren't you in class? I'm like,
Well, I emailed him, do you want my email?
he mad at you? That's so funny.
It's like you talking about.
I already showed you there.
Oh my gosh. So it wouldn't be like the.
I don't email formally ever.
I
I started putting emojis in my email to you guys because you two were so damn formal. I was like, you're getting my emojis and my shorthands.
I was like.
That's why at one point I just started putting the sent from my iPhone in there too.
You also said all the, there's 20 questions. I thought that was rude.
Yeah.
I don't give a shit. If it's short enough, why should I bother?
Normally, I try to keep it really formal, but also I try to keep it like.
I have a guy who texts me like he's sending me an email. And I'm like, brother, I'm just telling you to come over.
Like, until I learn that like you're chill with me, I'm gonna like be really formal, but once you're like. How is it going? I'm like, yeah, all right.
Yeah.
Formal
I liked, you sent one of your first emails, your ending was like, what was it? It was something really funny.
I don't know, we'll see.
It wasn't like sincerely, it was one of the like.
Once you sent me the one that said Dr. Lloyd is going to give me an aneurysm.
Okay, I had to chase him down to get the exam. He showed up a minute before your test was and said, oh, let me print that out for you. Oh my
Wait,
god.
wait, I have a question.
Yeah.
Okay, sorry, so thinking back at my notes on the whole like acetylcholine.
Yeah.
thing. Okay, he talked briefly about the nucleus-based silos of my nerves and how that has to do with like
Oh.
like with Alzheimer's and how like if you were to treat that, you would want to give an acetylcholine esterase inhibitor. Do we need to know that?
Now, normally I would say no, because we didn't do that, but he's been like loving those questions recently. But like, why would you, like 2 of your tests talked about the vagus nerve stimulation.
Yeah.
So I would, yeah, I would, know that.
What do you not need to?
Seriously.
You should know everything.
You don't need to know how to make meth. He went out.
But like, if you do, that's
me up.
funny.
That's extra credit.
Yeah, so yeah, just.
I already studied that.
Yeah, I said that like a while ago.
I'm wasted.
Okay, cool.
I'm wasted.
High school work.
So you said it was the nucleus bisect.
Okay, so here's what I have. Nucleus-based salivary. The nucleus-based salivary nerve is the first tissue to degrade in someone with Alzheimer's. When the cells deteriorate, they become demented/aggressive. To treat this, you would give a patient acetylcholine esterase inhibitor because it slows the breakdown of nucleus-based salivary nerve. I don't know if that's the last part is true. I think I just kind of like wrote that, but.
Well, yeah, so you would give them that because think about when we talked about like the COMT inhibitors and or the MAO inhibitors, where like if I'm not producing enough dopamine or serotonin, I'm gonna get those things so that they stay, those neurotransmitters stay activated longer. Giving somebody a acetylcholine esterase inhibitor is going to keep acetylcholine active in the like on the receptors longer, and so it's going to increase that communication, or slowing down the effects of Alzheimer's.
Okay.
Okay, so I'm gonna pull up this thing because I know what these words mean allegedly. Oh, we need to do GABA and glutamate.
Yeah.
We'll do that at the end. So.
I talked about GABA this morning.
I don't have it. Okay, so you have agonists and antagonists, right? Agonists increase activity.
We do have a civic group tonight.
I know it's late, but that's so cool and so swag if you guys are right.
Wait, what's the
I have a meeting at 8. I have my D-shift, the one I lead at 8 PM.
Your what?
I lead some guys
Oh, discipleship.
discipleship,
I
yeah.
did with Madison.
Yeah, maybe, she's nice. Do you know Heidi
Heidi.
Lewinka?
I don't think so.
Okay, she's just friends with Madison.
I don't know a lot of people.
Okay,
If you all have ever heard of like
But
an antagonist, think like bad guy.
so,
guy.
Think like
Love it.
they're stopping the good guy from doing the thing, so their activity is going down.
yeah,
An agonist is like not the antagonist of the good guy. The activity is going up. That's how I've always tried to remember it.
Yeah, one enhances and one diminishes.
Yeah,
Yeah.
so this one diminishes, this one enhances. And so a direct one is, there's only like one type technically, it's the mimetics.
Yeah, I think.
So a mimetic is a compound that binds and stimulates the receptor of a neurotransmitter, but like isn't that neurotransmitter. So you wouldn't say like serotonin is a mimetic because it just is serotonin. But something like nicotine is a mimetic for acetylcholine.
Or opiates.
Don't think guys. Right.
Nicotine and opiates, THC, all of those are mimetics. Quite literally, it's in the name, they mimic another molecule and they fit into the same receptor.
And then stimulate it.
Yes, so that's why it falls under direct agonist, is because it's directly binding to the receptor. So, hold on, I'll get to it in 1 second. But direct being the same indirect and direct pathway that we were talking about, like ion channels way back in the first exam. Direct is going to like actively be there. It's binding to that receptor, and indirect is going to be on like the pathway. It's not going to be the direct binding.
Yeah, it's gonna, through some process,
Yes.
is going to.
And you
inhibit it.
Yeah, so nicotine and opiates, they are direct agonists for acetylcholine.
This one is for,
I don't think you have to know what.
not what they're for, I'm trying to
Yeah.
remember what
I don't
opiates is.
know.
Nicotine is for
Yeah.
acetylcholine, it's for nicotinic or receptors. I
have no
can't
idea.
remember.
GABA.
GABA, thank you.
So let's go back to the, whatever the hell that's called, the
Mimetics.
extra one.
Mimetic.
And what?
So it mimics another neurotransmitter.
So it binds, so it mimics another neurotransmitter in the sense of it binds to that neurotransmitter's receptor and stimulates it.
This stimulates it or stimulates?
Stimulates it. So it acts just like the neurotransmitter, but isn't the neurotransmitter itself.
It's like if I dressed up as Ronald and then came in, and then you all were like, hey, it's Ronald.
I hate that so much.
Oh my gosh,
So if you just cosplay for of me for the test, I'll give you 8 points extra
Oh
credit.
my god.
I'll freaking put that on my test.
I was on the. This paper, I found this crazy lit picture. Crazy.
Wait, is that the one of him being really young?
Yeah,
Wait,
I
I wanna see it.
Wait.
Maybe I've
Let's
seen
see
it.
it.
I really want to.
Where's the young Bob?
We could be
Yeah,
up.
me too.
Is it the one where he looks really red?
Oh, turn it around. Let me see that cheek.
Like,
I just need a blue and yellow for his
I hate it.
flags.
His
It
slides
looks-
are really ugly.
They are really ugly. They're like an eyesore, especially
You
in
need to show the
experimental.
class.
What was it called, Carly? Do you remember?
What, psychopharmacology,
Just psychopharmacology?
that's what the title of the slide said, I think, but I was more distracted.
It was just
by-
one-
Oh, it's definitely this one.
Oh, there it is.
Boom.
God, young guy.
I love his ponytail now. I'm not gonna.
No, I love
He
the
looks
ponytail.
so.
I want
red.
rare.
Wait.
Jazz does that.
I know, I want to break
crowds.
Look at him.
Oh my God.
Maybe a ball
young guy.
Literally.
You know what?
A ball Santa. If you draw him with the ball.
Wait, have you seen the video?
Wow.
Of the-
I'll literally be like
I
doing
think-
with everyone and I'd be like, have a Bob Lloyd up, you know.
Sorry, I'm not
as one
talking.
does.
I need
They're like,
to
Santa.
look something up.
Watching the Zoom, like, I see that fucker every day.
One of my friends, he was walking in the hall singing and she hears from behind him, she's like, stop. He turns around, he goes, are you a vocal major? And she's like, no. And he goes, who are you? And she's like, she goes, who are you? He goes, I'm Bob Lloyd. Does this not look like Bob? Have you guys seen the old guy who vapes on YouTube?
Yeah.
He looks just like Bob.
Wait, so old guy.
It's Bob.
Yeah.
Is it mimetic?
Why don't we go?
Maybe just send this one on to the class.
That's so
Yeah,
funny.
Additionally, look out this video.
Does Bob look like?
I'm gonna link this to.
What's the demos of experimental stuff?
Yeah.
Like the demo videos that he has, and he
Yeah.
has short hair.
Oh,
It's crazy,
weird.
like,
Oh,
I
yeah.
wonder how
No,
long he's had long
That's
hair.
what I'm wondering too, how long it took to grow that out, probably like.
I would
a
assume,
long
I feel like he
time.
filmed those during COVID.
Probably.
Like, that's what I assume when everybody has online videos. I just assume it was from 4 years ago.
Yeah, me
He just
too.
like didn't get a haircut ever again.
Oh, yeah.
That's where it grows fast then.
Dude,
Yeah,
that was
so-
4 years ago.
But you did that way through.
Yeah, what is he doing?
I used to have buzzed hair, like, when I started this semester.
You buzzed?
And, like,
Okay, boys'
down
hair
to
grows
the
out so
side.
fast.
Yeah, I don't understand.
why?
Like,
So
my
growing
boyfriend
out
just
hair.
cut his hair come to a similar length that you had, and it's already down to his shoulders after like.
Nice.
Right. My
Okay.
parents are the same way.
So.
For direct agonists, then, you have what, sorry, yes, for direct antagonists, you have what are called receptor blocking molecules, which function like a mimetic, where it matches in a way the structure of a neurotransmitter, binds to the receptor, but it does not stimulate. And a receptor can only take one molecule at a time. And so if you're blocking all of these receptors, then you can't, have activation. For example, so succinylcholine is a acetylcholine direct antagonist where it binds to the. Is it in it?
I have in my notes that it's both a.
It's kind of, so it's
Both
at first a
and-
direct one and then an indirect one.
Okay, so it's direct first.
Cause it'll like activate it, but then it'll stop activating it and then just stay there. A better example is. Caffeine, cause it'll
Yeah.
bind to and block
Oh.
adenosine receptors. Yeah.
Wait, but it.
This.
Yeah.
Yes.
Talks about alpha
Caffeine as well.
Okay.
Cobra snake, cobra like thing.
It initially binds and stimulates a acetylcholine receptor, but does not come unbound, preventing further stimulation.
Yes, neuroleptics are,
That's what he was talking
but
about.
he didn't get to it at this point, so I mean,
Okay.
we'll talk about
Let's
it.
talk about-
Okay.
Because he saw my notes. Yeah, that was cool. Because he was right, when he saw your notes, he's like, anyway. Yeah.
Starts with a V and. I don't think he actually has value. Like the V of words. Bob Lloyd is my drug dealer.
Yeah, this is everything he
I-
said, okay, this is the whole lecture, we question everything.
Professor, because I was working with flies and opioids, and
But
I realized
This is a lot.
I-
It
I
is a lot.
basically went in,
He told
and
me
the
this stuff.
professor-
I didn't know anything more.
You'd be able to rate my entire budget was- if you want. I basically splice human opioid receptors into flies. By the way, do you want morphine for that? And I'm like,
By the way, do you want morphine for that? Oh my god, yeah. Wow, that's crazy.
yeah,
So like an MAO, be an indirect.
or like L-dopa.
True.
Is Bungaro toxin one word or is it 2 words?
Bungaro?
Alpha Bungaro.
How do you spell that?
I think you spelled it right.
spelled it
I
right.
just wonder if
You did spell it right. Wait,
You forgot.
is there an A after the G?
Yeah.
Yeah.
Oh.
Bungaro.
Bungaro.
Wow, choline, is that like a paralytic thing?
Yeah, so it's, and it should be up here as well. So it's both, because you have the receptor, you have the target tissue, and then you have these receptors, right? And then succinylcholine comes in and attaches to them, and then at first it stimulates them, right? And then it stops stimulating them, but it doesn't break off, and so now it's blocking the receptor. Does that make sense?
One more.
Wait, I got it. Okay, I'm
Hit us
using
with
your
it.
Quizlet. So in simple kind of words, succinylcholine is both a direct agonist and antagonist because it initially binds and stimulates the receptor, but then since it doesn't come off, doesn't come unbound, it prevents further communication. So it stays and sticks and then doesn't leave.
Yeah.
Yeah.
And so like when somebody receives, succinylcholine, their like muscles will tense up because, acetylcholine stimulates skeletal muscles. They'll tense up and then they just like will become paralyzed because they can't like turn off the communication, so they'll be permanently like tensed until until this like wears off.
Is that succinylcholine thing? Do you guys remember when he was like yapping about, what's it called? He said he was trying to like paralyze this guy with the PA. The fucking shit. Oh my god.
Yeah, that's succinylcholine.
The what?
The thumb where the guy like was paralyzed for
gave him,
like
like,
40
5
hours or whatever.
Oh, yeah.
Yeah.
No, we didn't live there.
This year,
Holds on and doesn't let go.
Yes.
So it can't further find its.
Yeah.
I'm gonna write something down.
So no,
Something.
so, but there's 4 ways that it can be an indirect agonist.
Perfect. It's not like a release. Yeah.
So can you tell metabolic cascade?
Oh, just through like chemical reactions. I know he's like using that word recently, so. No, metabolic cascade.
Oh, okay.
If you guys are looking for examples of indirect agonists, I also have stuff like Prozac as like a SSRI. ingredient.
Yes,
That,
thank you.
Oh,
Cocaine,
cocaine.
amphetamines,
Yeah.
COMT inhibitor, MAO inhibitor. Anything that is like increasing the activity, but not like directly binding.
Just like all drugs of abuse up here.
Yeah, literally.
So,
Metabolic cascade is, what is metabolic cascade?
chemical reactions.
Just another reason I blame chemistry.
There's, I don't know, there's another outlet over here. What?
Cascade.
No.
He is on.
I don't understand 20 of the words.
Hemicoline.
Is that lithium next?
Lithium next, yeah.
Yes, lithium is an indirect. You can go off about that.
That's all
Okay.
I know.
Here it is, synthesis, reuptake, release.
Lithium's crazy.
Okay, so there's 4 ways something can be an indirect agonist. It can increase the synthesis of a given neurotransmitter. Think L-DOPA. The more L-DOPA you have in you, the more dopamine you're gonna have. It can reduce reuptake. Think Prozac, so like an SSRI, reduces the reuptake of a neurotransmitter. Therefore, it can stay on the target tissue, activating it for longer. You can increase the release of it. Think amphetamines or cocaine, which cause the release of more dopamine, or it can decrease enzymatic degradation. Think of a MAOI inhibitor or COMT inhibitor, which that way it can stay in the synaptic cleft longer before getting broken down.
Wait, what are the arrows mean?
Increase, decreases. So it increases synthesis, increases release, or it can decrease reuptake or decrease enzymatic degradation.
That's fair enough.
Oh.
I do like the arrows. If you know, like if you take down one thing, take down the arrows of like what increases and what decreases, because I think that might be.
Yeah.
Probably.
I guess it's important. Amphetamines actually are a double indirect agonist where they increase release and decrease reuptake. But cocaine only increases release. So if he asks why is amphetamine a double indirect agonist, it does this one and it does this one. Yeah. Well enough.
I spelled it with an E and my Google Docs spelled it.
What else is an indirect between a methyl paratyrosine and lithium? What else? Do you have any others that are known?
that are, which one?
Indirect antagonists.
There's, is hemicholine one?
Alpha methylparadigm.
Hemicholine is one? Okay.
Yeah,
Respirant.
Restipine?
That's the one. I had it written down, but I could not read it. I was like, what is that? Respirate.
Something.
Like,
That comes from a
I think
plant.
it's just looking at what.
Is this the one that like the,
You have, it prevents monoamines from translocating into the vesicle, causing enzymatic degradation.
I said, man, I'm so smart.
Wait, could you explain the whole thing about amphetamine again and what it
Oh.
qualifies as?
So amphetamine is a double indirect agonist because it both increases release and it decreases reuptake. So it does two of the four things. And so it's an indirect agonist in two different ways.
The double indirect antagonist or
Agonist, yeah.
Is that for dopamine or serotonin?
Dopamine.
You said
All drugs of abuse
Double
activate,
agonist?
increased release in the nucleus accumbens, which is dopamine.
So amphetamine is just for dopamine?
Yes.
I asked him that in class and he said 4 of the monoamine.
Oh, no, he's right. Sorry, I'm totally wrong. I'm so sorry. It is for the monoamines.
Okay.
I'm so sorry. I was just thinking of the nucleus accumbens, which is only dopamine. But yes, amphetamines, cocaine, I think both of those are for monoamines for sure. This one.
Yes.
Yes? Okay, Noel said yes.
For monoamines.
Monoamines.
Cocaine, meth. Oh, methamphetamine, I mean, yeah. that fits.
Meth, wait.
Yeah.
I don't know.
Yes.
Like we see for the indirect agonist, like it increases the release.
It can increase release, yeah.
Release of this.
The
Anything.
neurotransmitter. Yes.
The 4 different neurotransmitters that monoamine.
Hey, so we're gonna send that thing. I just sent that.
Wait,
Or we think.
I think it's dopamine, serotonin, norepinephrine, and epinephrine.
Yes.
Or
Are the
the
4
four.
MAO,
Or neurotransmitter, it's like reactions.
aminergic.
I don't know.
I think it's for like what the agonist and antagonist can do to like their effects. What would you qualify synthesis, reuptake, release, and enzymatic degradation as? Like
Those
The
are
four ways it can be indirect.
Okay.
Yeah.
4 ways.
And then for indirect antagonist, just flip the arrow. So like, it's gonna be decrease in synthesis, like lithium. Lithium decreases the synthesis of, no, it inhibits the communication,
Yes.
which would be none of these.
So
It-
the
it
4
does
ways for
decrease.
or for
But it, yes, or it is this.
direct are just the opposite.
The four ways that it can be,
The
Um,
increase or opposite.
So the 4 ways that it can be direct are just decreasing synthesis.
yeah, these are the four ways right here. I'm just gonna erase these right now because it's gonna get, don't even worry about it. It's gonna get confusing and irritating for me to deal with, not because I'm breaking down. It's been a long semester. Locked in. I've just been repeating that to myself.
Lock in.
I was,
They're
I did
just-
the last 3 weeks, like lock it in.
locked in.
There are 4 ways that like you can just kind of like look at a drug or like a molecule. And if it's affecting a neurotransmitter in those ways, like if you're seeing an increase in synthesis of dopamine, like L-DOPA, you're seeing an increase of synthesis of dopamine, meaning it's a indirect agonist.
Yeah. Because L-DOPA isn't binding and stimulating dopamine receptors. So it's not directly acting like dopamine. It's indirectly causing more activity because it's helping to synthesize more dopamine. Prozac is a SSRI, selective serotonin reuptake inhibitor. And so it's decreasing, it's inhibiting serotonin reuptake, which means it's out on the target tissue for longer, increasing its activity. So although it's not binding to serotonin receptors itself and increasing that activity, it's indirectly doing it by decreasing the reuptake.
Like the MAOI and the COMPSI.
Yeah, so those inhibit enzymes that break down
Yeah.
certain molecules. And so if there's no molecules breaking down, if there's no enzyme breaking down the neurotransmitter, they're gonna be on the target tissue longer, activating it longer and increasing activity that way. So yeah, MAO inhibits like say dopamine activity. The MAOI inhibits the inhibitor, double negative makes it a positive. And so the MAOI isn't binding to a dopamine receptor and activating it, but it's inhibiting the inhibitor. Yeah.
The double negative is increasing.
Yeah.
the amount of
What
molecules
do
that you
you
have.
think would be like an example question of something he may ask, like regarding this, like, cause if he asks, like, in what way does, I don't know.
You would ask something like how is cocaine an indirect agonist?
Yes.
And then you would say like it blocks reuptake for all the monoamines, or how is Prozac an indirect agonist? In what 4 ways can an indirect agonist or antagonist affect neurotransmitter communication? Those kind of things.
And then you just respond with like either the arrows.
It is.
So is this like all the 4 also with, antagonists as well, like, is it just same thing or are we getting?
Indirect agonist.
So for the indirect agonist, it can be these things. The reason I didn't put up there, so like lithium, what lithium does is it inhibits the chemical reactions in a metabotropic synapse or metabotropic receptor. So do you remember like inositol trisphosphate and phosphatidylinositol? Do these words?
Like lithium thing?
That's so lithium decreases activity because even though the molecule binds the receptor, it doesn't activate it because there's like the receptor itself is broken, which isn't really any of these. And so it's like, I was like, but if you flip the sign on any of these, that's the way that an indirect agonist can work. So hemicholine, no. That one just blocks the receptor site too, doesn't it?
But
Maybe,
So-
yes, maybe no.
Well, even if it did block the receptor site, it is decreasing the synthesis of whatever like would be created.
Oh, well, here's a good one, guys.
with the antagonist though, it still does.
That's, yes, alpha methylparatyrosine.
Oh.
Is that on?
That's an important one to know. I
So
thought.
alpha methylparatyrosine decreases synthesis of dopamine because the enzyme tyrosine hydroxylase binds to this. And then it doesn't, or it would bind to it and then you're not gonna get as much dopamine. Because I think it binds to it and then it doesn't come off.
Yes,
Um,
Are we putting that under indirect antagonist?
yes.
yes, indirect antagonist.
Wait, can you explain that again?
Yeah, so alpha methylparatyrosine decreases synthesis because tyrosine hydroxylase binds to it because it's tyrosine. But then it doesn't hydroxylate it, it just binds to it permanently. And so you're getting less L-dopa inside of you because there's less enzymes being able to create L-dopa from actual tyrosine, from regular tyrosine.
So wait, it's doing that, it's binding to the enzyme that makes tyrosine L-dopa or?
The enzyme that does that binds to this,
Yeah,
and then-
but that enzyme is working,
it permanently binds to
It's
it.
blocking it from making
yeah,
Yeah.
future stuff.
So it reduces the synthesis.
what's the name of the enzyme?
Oh, tyrosine hydroxylase,
Yes.
yes. So like think about as well how like caffeine will bind to phosphodiesterase. So that you can't turn off the metabotropic synapses because it like permanently binds to them. Earlier, we talked about that, and that's basically what's going on here as well.
Did you break that lamp?
No,
lamp?
no, it was, that's how it was when I came in and I was like, uh-oh.
That's something somebody who broke the lamp.
Yeah. When I was in Chicago this weekend, there was a guy in our hotel, he like bumped into this lamp and it just like shattered around. He's like, wasn't me, could have been me.
The arrow only for with the indirect
Indirect
agonist.
It's like flipped.
You flip it for.
But it
Indirect
is
and
flipped
antagonist.
though for indirect?
Yeah, these are
Would be-
flipped. So but this is indirect agonist,
Yeah.
flip the sign, and that's how indirect antagonists can work.
But the direct ones don't have the little.
No, because these are binding directly to the receptor and stimulating them.
You can think of like direct versus indirect as being like, direct is like the immediate like receptor. And indirect being like a pathway. So like if you affect it upstream, then you're like preventing something from happening downstream. It's kind of like you're building a dam would be like, I guess, an indirect antagonist for water down the
The
pathway.
water level, yeah.
Yeah,
Where like a direct antagonist for water level would just be like taking buckets and throwing it out of the river itself.
if that makes sense. I don't know. That analogy was kind of weird.
No, it does, yeah.
That's the same thing, that's parasites.
That's kind of how
I
I
mean,
always
yeah,
try to
para.
remember
It
it,
does
where it's
have
like
para.
indirect is like
He'll say
not the
so it's just like
direct thing that's like
identification.
impacting on it. It's like something else down the road, and then you're just like affected by whatever's happening.
How will like. I guess, like I understand the difference between direct, indirect agonist and antagonist. I just don't understand how you know what it is when you ask a question. Like if you're like, what does this do? And what, you know what I mean? Like.
That's
how
just
do
like
you-
You just
memorization.
memorize it, honestly, just
There's
memorize
like
it.
no hacks for it.
Yeah.
Like, when you ask the question, like, how do you know cocaine is an indirect agonist? I don't think I could explain, like.
That's
because of the
just
box.
memorizing.
Because of the box.
Yeah,
Like, I don't know.
sadly.
Yeah, just being like.
Well, but
eh,
also if you memorize how to draw the box and then draw the box on the test. Like.
What I've seen other students do, which I think is really good, is sometimes your TAs give you the blue book early.
Oh, yeah.
And so you can write stuff from your notes on the blue book.
That's-
And then you can just have like a little note sheet there.
Professor does.
What, no, you
It
can.
depends on the
Yeah,
TA.
TA, sometimes your TA gives you the blue book early.
You did that.
I have done that. And then I got the blue books back and I'm like, oh, they wrote stuff on it. That's a good idea.
Wait, when?
Last exam.
Oh, you weren't there.
I scribbled so much, he gave it to me, and I was
Yeah,
Yeah,
I didn't even
before you
think about
start.
that.
Maybe I should give you guys the blue books early. I usually don't, but. Sorry, I'll do it.
Couldn't work.
Okay, also, don't cheat right in front of my face. I saw somebody scrolling on their Apple Watch and then doing this and going. I was like, it's too late to do anything about it now,
I should
but
have
like.
way better cheating prevention. I just sit there and read.
Well, no, I just don't pay attention, but I glance up and I'm like, oh my god, are you serious? Literally going like this and writing. I was like, be better. If you're gonna cheat, make sure I don't see. Like, I don't give a fuck if you're cheating. Just don't let me see it in front of my face. Ugh.
Cause
That's
then
all
like,
I'm gonna say.
Ruin your
it's like when your
career.
RA is like, I don't care if you're drinking, just don't let me know.
Don't let
Cause
me
like
know.
I have to do something about it.
Yeah, I don't wanna have to tell Dr. Lloyd you were cheating. Like, I didn't, because I also didn't know if that was 100% what she was doing, and I was too tired to care. But just don't cheat in front of my face, and you'll be good.
Yeah.
Mhm.
Okay, any other questions about this? Cause then we'll get into alpha methylparatyrosine and neuroleptics.
But yeah, like, as an example of like, how would you know what these do? I mean, just kind of try to memorize the box and then like know what molecules do what. So kind of like in the past exams where it's like, you know, what does dopamine do? You just kind of have to like know it. So if you memorize the box and know where, like what molecules go in the box and know what molecules are like direct agonists, that'll really help.
He will, but he will ask a question, probably like, how, in what way is cocaine an indirect agonist?
Oh, yeah.
And that's when you're gonna
And-
wanna know,
yeah.
it like inhibits or increases release, or is it, which one is it?
Cocaine,
It increases release,
Increases release and amphetamines does both.
and amphetamine does both, yeah.
Yeah, so basically just kind of like knowing how the molecule affects the body, can also kind of like give you insight. So like nicotine direct agonist. To me, it just kind of makes sense, but like I could definitely get how.
Because it's like, oh, well, I think it's just because like we know about like nicotinic like receptors, and so it's like, oh, those are receptors that are activated
Yeah.
by nicotine.
You might just have to
Or
kind of
like cocaine
review.
makes people feel happy, so they get more dopamine, so it increases release.
One other thing you could do, like,
Makes sense.
I didn't do this, of course, because I didn't do very good on the exam, but like, if you made flashcards and like had like direct agonist cocaine, or like, what does cocaine do?
That's a good idea too.
And then flip the cards over and then been like, all right, that's what it does. Yeah,
Speaking of flashcards, could you link Ronald's quote?
yeah.
I'm gonna just make a different one, honestly.
Sure.
Because
Mine are
this
like
is-
halfway between.
yeah, it-
400 terms.
Slow down.
Radiation ally for lithium.
Lithium.
Lithium, yeah.
I'm also gonna try and find crash course videos because it'll always help me. Yeah.
Yeah.
Okay, so I feel like, so like what you guys are saying, like, would a question be like, how do you know nicotine is a direct agonist? Would you just say it's mimetic?
It's a mimetic. Yeah, he would say something more like,
He would ask like, what is nicotine in terms of,
how does it affect
Yeah.
synaptic communication? And then you would say like, oh, it's a direct agonist because it's a mimetic.
Yeah.
Or he might say, why is cocaine an indirect agonist? And then you would say it increases release.
I feel like also knowing the ones that are double,
Yeah, so
Yeah.
but that are like special.
succinylcholine is both a direct and an indirect agonist.
I remember that one 100% was on our last
Yes,
test.
that-
That one was on our
And
test for
why?
sure. The double one, but I don't, yeah, I don't know if it'd be on the same.
Because it both
It binds
binds
it
to the
and
receptor
stimulates.
and stimulates it, and then it can't like release from the receptor, so then it blocks and then inhibits.
Yeah,
So that's where it's like, it binds at first and then it works, so it's agonizing it, it's like directly binding and increasing or like stimulating the receptor. But because it can't release, the receptor can no longer be stimulated by anything else, so it becomes antagonistic because it's decreasing the activity of that receptor by like blocking it.
because like to move, you have to like flex a muscle at first. So you need activation and then you have to like unflex that muscle to move it again. So you need them to break off, but they can't break off. So you're just gonna be like permanently like glued in one
Stuck,
position.
paralyzed.
Yeah.
In one of my neuroscience classes, I had a professor do a really nice analogy where it's a high five, where you get a high five.
Yeah.
Oh, yeah.
And bam, that's an agonist. Now if someone else tries to high five me.
Can't do
and
it.
You can't
Yep.
do this. thing.
Oh,
Now-
that's good.
Yeah.
I think we kind of did that.
But must have stolen that.
Yeah.
I
think we did that in-
No, we didn't, it was the, like, hold your hands together, okay, well, see how they're
Yeah.
so similar, and then he like releases,
Yeah.
and then he brings his hand, he's like, oh, they look alike, but they're different, and then
Yeah.
you told me to bring mine back, or, no, he brought his back, and then I tried, yeah. He did that, he did that whole hand
So it's the
demo.
receptor.
No,
blockage.
on the first day of experimental design, he goes up to me, he goes, take your glasses off. And I took my glasses off, and he's like pulling a pencil into my eyeball.
Yeah, I talk about the lobotomies.
Mhm.
The monkey
I-
that he
I
talks
almost
about for
did
the
myself.
lobotomies is in our chapter, this unit for cognitive neuroscience. Yes.
Yeah, I didn't-
Alright, can I ask you to like go through like the ones that you have written up, like how the.
Yeah.
Before.
So nicotine is it directly binds and stimulates acetylcholine. Opiates directly bind and stimulate to GABA receptors. Caffeine will bind but not stimulate adenosine receptors. Alpha bungrotoxin binds but doesn't stimulate acetylcholine
Are we going
receptors.
to know that? Like, are we gonna have to say like,
Yeah, probably.
what?
Some like a random array of these you'll wanna know.
Yeah.
I feel like what he's gonna do is like.
All the different names of the neurotransmitters.
I don't know, but like, what he's saying about like, it binds to this, whatever, adenosine. Am I just like dumbfounded right now?
It is, no, it is a lot of
We
info
didn't write it up here.
that is just kind of,
That's
Like,
just so.
I sent a.
And then
like, if you just Google the like molecules too.
It'll just tell you
Tell
right
you
there.
what they do.
usually, yeah, it'll be like, it is a blank agonist. It is a
Yeah,
blank indirect agonist.
I was doing that like 15 minutes before this and it was just like, okay, well now I know what everything is.
Yeah, and then succinylcholine is both, we just went over that. Binds, stimulates, but then doesn't break off, and so you can't have continued like activation and inhibition.
And then what is it bind to?
Acetylcholine.
See,
So if you just remember choline.
Okay.
Pretty, kind of tells you the name. Indirect agonist, so L-DOPA increases synthesis because it's just the precursor to dopamine. Prozac decreases reuptake, so Prozac is an SSRI, selective serotonin reuptake inhibitor. So reuptake inhibitor, yeah.
So if you guys go to the first set of lecture notes he sent out and go the third one down, this
Yeah.
chart is like the first thing you go through and has all that on it.
I'm also
Yeah.
putting it in the notes.
Perfect.
I'm putting a picture of it and I've
So,
made a
it's
chart.
with all like the links, it's the first one he sent you, the third one down.
Is the slides?
He like goes over that chart. Yeah,
Okay.
it has-
There should be slides on Canvas as well.
Yeah.
Also rewatch the
I think.
lectures, like, that's gonna be
Yeah.
your best bet is rewatching the lectures too, to see what he actually has to say instead of this kind of chaos.
Okay.
Which is fun, but,
And then you can like pause it and think about it for a while.
oh yeah,
But at least you can hear us, unlike the
oh my
videos.
god, yeah, we're talking loud enough to hear.
Yeah, cocaine increases release, and then MAOI decreases enzymatic degradation, because it inhibits enzymatic degradation.
And then COMT-I, would that also be enzymatic?
Yep, exactly. And then the acetylcholine esterase inhibitor would also be an indirect agonist for the same reason as MAOI and COMT-I.
And that would be that like the enzymatic degradation. What was you saying earlier? Wait, what did you say that?
The acetylcholine esterase inhibitor would, yeah, that would also be enzymatic degradation.
Oh, that was. I'm so glad I was taking class again. I'm so.
My buddy connection's not gonna be any better.
It's gonna be so fun though.
I had a friend take evolutionary psych with him last semester, and their final was write me a paper on something in evolutionary psych.
Oh my god.
I was like, oh, great.
Give $2.
No. And then the only one I can actually remember here, well, I can remember both these. So lithium turns off the receptor. So indirect agonist insofar as it just turns off the receptor entirely. And then alpha methylparatyrosine decreases synthesis because it prevents regular tyrosine from getting turned into L-DOPA.
Oh, you just had that on your other test, didn't you?
Alpha methylparatyrosine. They had it just the other day, but I don't think it
Oh,
was a test.
okay.
Cool. Am I good to erase this?
I'm gonna take a picture first.
Yeah.
Can I ask one question?
Of course.
What's
This one?
the blue word in indirect antagonist?
Recipe,
Reserpine.
What does that do?
good question.
I'll look it up really quick.
It's a plant,
Oh,
maybe.
I can tell you what it does. It prevents monoamines from translocating into the vesicle, causing enzymatic degradation
Yes.
via MAO.
Yes, so when monoamines are made in the bouton, they don't go into the vesicle. So they can't be released and then. They also get like broken down then. In there as well,
It's less serotonin expression, as we were saying about the recipe.
Cool.
and that's all you guys gotta know.
It's an adrenic uptake inhibitor.
Interferes with making of vesicles.
We said like 3 different things.
Go with whatever,
Yeah.
whatever he
Yes.
said.
I rewatched his lecture and the recipe, it interferes with the making of the vesicles that hold the monoamines, so then they just become leaky.
Yeah.
That
is what
that
he
is
said.
he
Yeah.
said.
Yeah.
Word for word, that's what he
Leaky?
said.
Is everyone very leaky?
So, yeah, it,
And just less serotonin expression is another thing.
it can also, it's used as a treatment for like high blood pressure. So what happens is since it's like, it's blocking adrenaline, from like constricting your blood vessels to like pump it up. So it's treating high blood pressure by like opening up the like vesicles, to be more like allow for flow to reduce blood pressure. Yeah.
Question. So what neurotransmitter does succinylcholine bind and block?
Acetylcholine. So just think like choline.
Okay, just what?
Well,
Oh,
they
yeah.
both have
Saying
choline.
choline in the
And then
name.
what about, alpha meth, or is it alpha?
Alpha bungrotoxin.
Actually, alpha methylparatyrosine, which one does that do?
It decreases synthesis of dopamine. Because tyrosine is a precursor to dopamine. And I guess, and norepinephrine and epinephrine, because they're part of the same chain.
Mhm.
Yeah, that's one of the reasons it's a one of the other difficult
I was
exams.
telling one of my friends he should take this class and he was like, oh, I probably don't have the prereqs for it. I was like, the psych department doesn't care about
They don't-
prereqs.
Oh my god, I bullied, what's it, Eric, the head of the department.
Eric
for psych.
Hessler?
I went to his office, it wasn't his office hours, and I said, let me take environment, oh my god, what are we in right now?
Was it?
Experimental design.
Oh, yeah, I
And
remember you
the
saying you had a
one
fight for it.
Credit, intro to psych class I didn't take, and he goes, well, you have so much time, I said, just let me take it. He's like, well, are you gonna be, just let me fucking.
That class is so lame.
Oh, the
The
fucking one credit thing, that was
Discipline and
stupid.
professions.
Yeah, oh my
Yeah.
god.
It was, I had to do so much work for it,
It was.
for it to be
so-
one fucking credit, and I try to like, I complain after, I go, there's too much work for this class to be one credit, and she's like, it's gonna help you so much in the future. I said, no, it's not. I already
It's
got
just like a
it.
weird prereq for experimental
I
design
had
as well.
fucking-
It's.
Yeah,
correct.
why?
No,
I didn't
I
have to
had-
share any other my psych classes.
I had shillings for it, cause it's like
Yeah.
you should be able just to
Yeah.
take stats and that should be the only prereq for
Yeah.
experimental design.
Wait, there's a prereq for experimental design?
There's two.
Yeah, stats and disciplines and professions.
Yeah.
Oh, okay, Laura and I took stats together last semester with Dr. Zimmerman, and every time he goes, do you guys know what this is? And I make a face at him, and he's like, how do you not know how this is? I'm like, he didn't teach us anyone.
He's always like, did your stats professor teach you? I was
No.
like, you were my stats
Right.
professor. So yes.
He's like, what makes sense me to teach you? I'm like, well, I would ask, why are we doing this? And he said, because you are.
Oh my goodness.
Not helpful.
I love
Thank you.
having to do any calculations in his stats class. Okay,
Anyway, sorry.
I think I'm good. Any more questions? Otherwise, we'll get on to neuroleptics.
Man.
Oh, yeah.
As a natural.
Learning
Yeah.
how
You know,
shiny.
And when we were writing the start down originally in class, you wrote neuroleptics as a receptor blocking agent. What does that mean? Like, what? It blocks as a broad, what is a neuroleptic again?
A neuroleptic, also antipsychotics, are dopamine direct agonists.
Okay.
So they decrease
So they,
dopamine activity by blocking the
wait,
receptors.
this is where I got confused with.
Neuroleptic.
But obviously we're gonna get into
Did
it,
I just say it was an agonist? Then I meant antagonist.
So-
I've been doing that a lot recently.
but this is where I got so confused with,
Uh-huh.
but obviously we'll get into it, but
One moment.
he would say like in
I
the Zoom saying neuroleptics are either indirect
review session.
agonist or indirect antagonist, because sometimes it
Right.
breaks down dopamine, but it also enhances synthesis.
Didn't you say that one of them has the same effect?
Yeah, this is what I,
Okay,
I
you
don't
remember
know.
when he was talking about homolinic acid, and he was like, yeah, schizophrenic have that in their cerebral spinal fluid.
yeah,
And then he was like saying how, something about like dopamine, that means like, there's like.
We'll get into all of that.
I think it
Yeah,
was like-
don't worry.
Because
But
the
we'll be
I remember
covering
going
it.
Back into class, I'm like, I don't get it. And then I listened to him re-explain it. I was like, okay, I got it now. We're also not gonna do the whole Johnny Walker, Jim Beam analogy.
Oh, the depressant plus depressant equals.
Because we just don't need to.
Mojo.
Okay,
Yeah, basically,
So-
it's summative. As long as you
Oh, yeah,
just
just-
know that
just
it's,
summative.
if like two negatives add together to make a bigger negative.
That one girl.
Negative and a positive equal out.
Lauren?
Positives.
Oh, what? Jaded?
oh,
And
yeah,
she kept on asking, she thought it was literally a class on drugs. Being like, I was so excited because I wanted to like learn how to.
Oh.
make drugs or something. Do you-
I remember.
And we were talking about alcohol, and she goes, how do you not get hungover? Because I'm hungover all the time. I'm like, girl, why are you? And then he asked something like, do you smoke? And she goes, cigarettes. And Lloyd goes, what? And she goes, well, not anymore. I was like, what are we talking about right now?
so so they gave schizophrenics, neuroleptics, and they developed pseudo Parkinson's, right? So they have Parkinsonian symptoms, but then like you take them off and they're good again. And so, I'm so bad at spelling.
Yeah.
So Parkinson's is caused by too little dopamine, right? But then they did a spinal tap on them, and they have an increased amount of homovinylic acid, which means that the body was breaking down more dopamine. So behaviorally, the pseudo-Parkinson's seems to say that they have less dopamine in their body, but then the increase in homovinylic acid seems to say that they have more dopamine in their body. And so to figure out, Okay, yeah. The behavior symptoms of pseudo-Parkinson's seems to say that these people taking neuroleptics have less dopamine in their body. Because having less dopamine would give you Parkinsonian type symptoms.
So behaviorally, they have, you would think they
Yes,
would
yeah.
have less dopamine, but actually,
But
they,
they did a spinal tap, and the
Word.
increased amount of homovanillic acid seems to suggest that they have more dopamine in their body.
so is it correct in saying that they do have more dopamine?
We'll get into that. So to solve this problem, like what actually are neuroleptics doing? Are they increasing dopamine or are they decreasing dopamine? They took patients and they gave them a neuroleptic, I'll just say NN, or yeah, plus alpha methyl.
They're like antipsychotic.
No.
Yeah, neuroleptics are antipsychotics.
The question we're trying to answer, like. Sorry, my brain's going away, continue.
Okay. And so alpha methylparatyrosine, like we talked about, is an indirect dopamine antagonist because it reduces the amount of synthesis. And so if neuroleptics also reduce dopamine expression, then you would find that people given both of these would do even better than someone just given one, because they have more decrease in their activity. But if the neuroleptic did not decrease their dopamine levels, but actually increased it, then you would find that they would have no difference in their behavior. Not behavior in pseudo-Parkinson's, but behavior in like schizophrenic symptoms. So I'm gonna do this.
Neuroleptics are often used to treat schizophrenia,
Yes.
antipsychotic, anti-schizophrenic.
Wait, isn't that just one type of schizophrenia?
Yes, only type 1, not type 2. Well, they do give them to people with type 2,
shouldn't.
but you shouldn't.
Don't think about that.
So. I'm gonna do this.
Basically, what they're doing,
Still assuming that.
Yes, so we're pretending like we don't know what neuroleptics do. So if you assume that the neuroleptics increase the dopamine, which is what the biochemistry seems to be saying, then, and then. And this always, we know what this does. So if we assume that the neuroleptics increase dopamine activity, and we know alpha methylparatyrosine decreases dopamine activity, you would have no change in their schizophrenic symptomology, because these two things are balancing each other out. And so they're, for all intents and purposes, biochemically the same, right? But
What's the dopamine decreasing underneath it?
it's just saying that's what alpha methylparatyrosine does.
Word.
So in case you forget, that's what these two things,
Word.
that's what this does.
Okay.
If we assume, like the behavior is telling us, that neuroleptics decrease dopamine expression, then these two things should summate and show you reduced symptoms in people with schizophrenia. They did this test, and this was the outcome. He never actually told us why HVA increases, but I think that's just
because it's the breakdown, so it's not being, more dopamine isn't being created.
what I thought it was is that the increased release from the autoreceptors was causing that HVA increase temporarily, but if you looked at somebody like months down the line, they wouldn't have that increased HVA. But we haven't talked about autoreceptors in this class yet, so I'm not gonna.
So the top is staying the same, like at equilibrium, and the bottom
Yes.
is just, that's the change that we need in order to see.
So this is saying if neuroleptics increase dopamine expression, like the biochemistry seems to suggest, then if we gave somebody a neuroleptic and this, or this compound, we would see no change in their behavior, in their symptoms. Because they're, like you said, it's equilibrium, they're balancing each other out. For as much dopamine as this is inhibiting, this is creating, basically. But if it's decreasing, like the behavior seems to be saying, then these two effects would summate, would increase the magnitude of each other. And we would see reduced symptoms.
That's why he says like in his alcohol one, where it's like, oh, if you have, say you've been drinking Jack Daniels all night, and then you get very like impaired. Well, if you start drinking Jim Beam, it's also
Gonna impair you more. This is
impair
like
you
drinking
more.
a Four Loko.
It's summative. Yeah,
The old Four Loko, and this
And then-
is
yeah.
just like, I don't know.
So basically, if you're like having one thing go up and one thing go down, they're gonna fight against each other and they're gonna kind of cancel each other out. But in the case of like the alcohol example, you're having two things that do the same thing.
So their effect is
Mo
going to.
drunk.
Mo drunk.
Drunk.
If you get drunk drinking Jim Beam and you get drunk drinking Jack Daniels, if you drink both, you're gonna get more drunk.
So
I
this is
know,
about
drunk.
pairing like a neuroleptic drug and another drug?
Yeah.
Yes, a drug that we already know the effect of.
Okay,
We know this decreases.
but you
dopamine
don't know the
expression.
effects of the neuroleptic?
Yeah.
Right,
it's
so
just
this
there's
was
two
the
different-
experiment that they did to determine what neuroleptics are doing.
Yeah,
And so they checked what the outcome was. And he talks about this being like the perfect test because no matter what your outcome is, you get some knowledge out of it. So if we saw no difference in their behavior, then we would know that neuroleptics are increasing. If we saw that their symptoms reduced, then we would know that neuroleptics are decreasing dopamine. And this is what is actually happening. They are decreasing dopamine expression.
so because we know what is happening, if somebody were to take alpha methyl paratyrosine, like, because we know that outcome already, we can already like predict what would happen if like, you know, we would have a dopamine agonist, or like if it's going to help or fight it based on the results that we get. So no matter what we see, we're gonna be able to tell based off of like what we know the results should be.
And we have to do this because we can't just look at what the neuroleptic is doing on its own, because we seem to be getting contradictory results. Yeah.
So this might be kind of a dumb question, but like, this is for Parkinson's, right? Like.
This is
drug.
schizophrenia.
Okay,
This is,
what
this is schizophrenic
Right.
symptoms, or, geez, guys, what did I say? So schizophrenic, and then if you give them, and then they get pseudo-Parkinson's.
You give them neuroleptics.
If you,
Yeah.
yeah,
So if you give them neuroleptics, they can develop like pseudo Parkinson's.
So, like, the
they start
tremors,
to get
Yeah, but then you take them off the drug and they're fine.
in the same way that like how schizophrenia is too much dopamine and Parkinson's is like too little.
Is
So-
this what the down regulation thing where like the less dopamine they have, the like more they produce and.
Yes.
So downregulation is from is an effect that occurs from taking a drug a repeated amount of times. So like if I have a drug that increases how much serotonin is being released, you're gonna have like an upregulation of serotonin. Downregulation of serotonin receptors?
It's like tolerance.
Yeah.
Yeah, so basically, the way I like to think about it is like, if your body gets used to like having so much serotonin in your body, it doesn't feel the need to make serotonin, so now your body is producing less serotonin normally than it would, so it's like your metabolism. You're now metabolizing, you're building less serotonin than you would because you're too used to having the drug do the work for you.
So here's the target tissue, and the neuron needs the same amount of neurotransmitters to have an action potential, right? And I'm having neurotransmitters come here and activate it, and then I'm just like for a long time having a ton of, we'll say, dopamine activating these. well, my body wants to be in equilibrium. It doesn't want to have like an increased amount of activity. So it's gonna get rid of some of these so that there's less dopamine attaching to here, because there's only so many attachment sites. And so you can't have as much activation in one moment, right? On the flip, upregulation, this is probably not even gonna be on the test. Upregulation is, I don't have enough dopamine in my body. And so there's maybe some dopamine coming into here, attaching to these, and then some of it is just kind of like getting lost. So it's gonna increase the amount of receptor sites so that we can have more dopamine activating this, to bring it back into that regular amount of activity or regular amount of neuron firing.
So does that have anything to do with, like,
This,
this? Yeah,
no,
those are two separate things.
Yeah.
Okay.
I'd say with like pseudo Parkinson's, that's how they get it, though, isn't it?
no, it would just be, I mean, if you're on neuroleptics, you might see some downregulation, but the pseudo Parkinson's is just that they're not having enough dopamine activation. And so that's actually, once your body regulates, then these would also go away. So this is like pre-regulation symptoms.
Well, I thought that there was something about the fact that like if you give them, you can like cause them to get Parkinson's.
Yeah, or that's like tardive dyskinesia. That's like extrapyramidal tract side effects. And so like, yeah, neuroleptics are going to reduce the amount of dopamine firing because of the autoreceptors. And then they'll get tardive dyskinesia. And then I think like those, yeah, and then you take them off the drug and then they get worse
Yeah.
because of the regulation.
Because of their
I'll
metabolism.
have to like read on that. But
That's
that's,
not gonna be able to-
that's
Yeah, you don't
beyond
have
the
to
scope
worry
of
about
this
that,
unit.
sorry.
Is this making more sense than it was the other day?
Yeah.
Okay, good. And then I think we just have to talk about GABA and glutamate.
Yes, which is really easy. GABA is really easy, and glutamate is really easy.
Yes, one of the big, I don't know if this is gonna be on the test, but it would be very important to know. Just as angry as he gets if you say that schizophrenics have too much dopamine, he hates that. He also hates if you say that GABA always produces an IPSP. Cause it's
Inhibitory.
postsynaptic potential. So that would be decreasing the voltage of the neuron.
Right there.
GABA is a universal inhibitory neuron, but it doesn't always decrease the voltage. So if you're
My hands are not working. We're gonna find it today.
so say your neuron, so GABA brings in chloride, which is that, and then chloride's equilibrium potential is approximately -70 millivolts, and so it's going to pull the neuron to that voltage. So if your neuron is at like -76, and then you have GABA ion channels open, then it's going to actually increase the level of the voltage of the neuron, because the neuron wants to get closer to -70 because calcium's gonna start coming out because of osmotic forces, right? Electrostatic forces.
What's, he said something about, oh my gosh, I don't really even remember. He was like talking about if something isn't at -70, it's at -65 or something.
Yeah, I remember that. He's like, if it's not at negative, if it's at -70, then, and then nobody knows how to answer, he goes, it's not at -65. Which is like, oh, yeah, this is true.
So like, what was that a part of?
So -65 is when there's an action potential. And so GABA just keeps the neuron at -70 so that you can't have an action potential. But his point with that basically, as well, is that GABA is not always going to produce an IPSP, because an inhibitory postsynaptic potential decreases the voltage always of the neuron. GABA is not always decreasing the voltage, it's just always getting the neuron closer to -70 millivolts. So it can increase it if it's like at -76.
It's like isn't it a universal inhibitor?
It is, so it always inhibit it, but it doesn't always produce IPSBs.
Yes.
A question he might put on there is, how would you classify GABA? And that's what that answer would be, universal inhibitory neurotransmitter.
Yes, and then glutamate is the opposite, where it's a
It's a
universal excitatory.
Yes.
Do they need to know what GABA stands for?
Probably
Yes.
Yes.
Don't
I know they need to know L-DOPA,
Yes,
for sure, because I remember getting.
I-
gamma butyric acid.
thought. Yes, write that down.
Okay, so know what GABA stands for.
Oh my goodness. this
I
one.
thought I-
Use the blue one.
Yeah, do it.
Oh, I love it.
I saw that there was,
He does say though,
I swear I remember that being on the exam, and that was one where I'm like,
Probably was.
I know what the letters mean, kind of, but I don't know what it is exactly. And I remember I got docked on it because I was like, I was close, but I wasn't exact. Look, that was the hard one, because like some people got like on the last exam, when it was like, oh, what does DOPA and
L-DOPA.
L-DOPA stand for? Like a lot of people got it right, but a lot of people
Butyric.
got it like close-ish, but like I'm looking for like the specific.
Dog, so many people in mine put, dopamine,
Yeah,
something,
that was the one that I saw a lot, where the D does not stand for dopamine and L-DOPA, sorry.
It's also really annoying that it's an O when it stands for hydroxy.
Yeah, that's the other sucky part.
And then every other time you say hydroxy, it's an H.
I think if you just said oxy, I was kind of like, eh.
Also I love, what's the nickname for Ben? Is it
Fennel.
For
Okay,
Yeah, I saw a lot of pickle.
I was so concerned, because I was like,
pickle.
I saw it once and I was like, what? And then I had to go back in my notes and I was like, what is they talking about?
That's what I felt about the banana. I was like, what?
And then I
banana?
went back into other people's notes, because I thought it was just somebody being like funny, because they were like, oh, I don't know it. And then, then I started like going through other people's exams, and then I started seeing it more and more, and I was like, uh-oh.
Yeah.
did they only put pickle? Oh.
Really? Oh, I didn't
thought
know any of
everybody
this.
pickle.
I was like,
See it, cheeseburger, see the vision.
Oh, on one of the first exams, so many people put the like cheeseburger analogy
Oh, yeah.
in their extra credit. I loved it. That was amazing.
somebody put, okay, on the first exam, I had no clue what they were talking about. Somebody, okay, if this is you, I'm sorry, I did not get it. And to be fair, you could have been totally correct. It did not click in my brain. Somebody described dopamine as a pizza, and something about,
What are you talking about?
somebody said that like dopamine was like the pepperoni, and I was like,
I think I had that as well.
justifiably, if you can explain that to Bob and you'd get
Oh.
points for it,
Yeah, you did.
I'm totally okay if you do that. I just did not understand.
How did they explain it? Cause I feel like.
Wait,
It
wait,
didn't
I
make
might
any
have
sense
one in
to
my-
me.
That could work, maybe. if
This
I
symbol
know
right
how-
here, by the way, is just the Greek letter gamma. So you might see that instead of this, just. In case, I just don't want you guys to get confused when you see the Greek letter instead of writing out the word gamma. Pop quiz, who remembers
Is
what
it?
GAD stands for? Who knows what GAD stands for? Yeah, Mary, do you remember what
Do
it
you know
is?
anxiety disorder?
And then GAD turns it into generalized anxiety disorder, turns it into, I just can't remember. it right now.
Glutamic
This is
acid
not-
decarboxylate.
But-
Wow. I
Oh
only
my
got that
God,
from my
second
notes.
one's
Don't worry,
out.
that one in from the dome.
The dough.
Who graded this?
I like
Did you
that.
grade this?
Big dough.
No. That's,
Did you grade this one? Did you see, this is not me.
oh, this one is me, yeah, I did grade this one.
Hilarious.
That's why I put the exclamation points.
Okay, this says psych majors are much above social majors, we could beat them up, and academic administrators are much below Dr. Wood.
Oh, true. I put exclamation points next to those.
I'm drawing in your guys' stuff, and like
He's-
giving you little notes.
Fair warning.
He started telling people that he was gonna switch their major to sociology.
Oh, yeah.
Fair warning to everybody, we do have like 10 more minutes. If you have more questions, I mean, this is pretty much,
GABA also
Say that
just
this-
looks like two glutamate molecules slammed together.
Yeah, he talks about a lot of like small things, like he went on a whole tangent. And when I asked him today, like, is this gonna be on the test? He's like, yeah. The like naltrexone, the naloxone, codeine, heroin, endomethacin, buprenorphine, all that shit. I asked him about it and he said, oh, really?
There's like the,
Buprenorphine, yeah.
there's the 4 types of
Same with the fluoxetine.
And
gamma.
It's the trans.
Oh, it says in trans. We just learned that.
NMDA.
Yeah, all the NMDA glutamate receptors also bring in calcium, which helps the blooming of dendritic spines, which increase long-term
We
memory.
probably did talk about it.
that?
Yeah.
I felt like we
Yes.
talked about it today.
So-
It's in my notes.
NMDA glutamate ion channels also let in calcium to the neuron. NMDA, yeah, which increases the blooming of dendritic spines, which is correlated with long-term memory.
What to the dendritic spine?
It increases the blooming of dendritic spines.
I had no idea
What
what
is
you meant
ND?
when you put that in your notes under time.
NMDA
NMDA.
stand for?
Yeah.
N-methyl something something. You don't really know. You don't need to know what it stands
Okay.
for.
Oh, is that the thing that he was
It's
like,
the-
don't worry about this one?
Yeah.
Yeah, it's
Yeah.
it's just the receptor. It's the type of receptor.
If he says, don't worry about this, he's on a tangent. Just ignore it. Most of
Or
Well,
remember it if
I
you
mean,
like.
look.
Or if you wanna
So-
go.
So the increases blooming of dendritic spines cause, or what?
Which is correlated with
Oh.
long-term memory. And then I think, did you ask me one time, how do seizures stop? Like months ago?
Yeah.
It's, I talked to Dr. Rebecca Gilbertson. She does a lot with like alcoholics and they'll have seizures.
Yeah.
And it's actually through GABA. So seizures happen because of an increase of glutamate, excitatory activity. And then there's going to be, to offset that, there's a huge increase of GABA activity, which stops the seizure.
How did you remember it was me?
Any of that.
I remember his face.
I don't.
I get 8
remember.
hours of sleep.
Wow.
If you have ADHD like me, you won't remember any of that.
I was in a psych eval the other week and at 5 a.m. Yeah, and I was talking to the therapist and I was like, my sister thinks I have ADHD. She's like, I'm gonna tell you right now, you do not. have
Yeah.
ADHD."
there ain't no way.
Do not.
And I was like, I think my sister's just.
I told Dr. Lloyd after class one time, I'm like, I struggle with this and this and this, and like, can you help me? And he goes, you know, one of my colleagues has ADHD, but, and I'm like, are you saying I have ADHD? He goes, and I got it checked and I got diagnosed with
Yeah.
ADHD.
Dogs.
Okay, but there's so many like false diagnoses.
Oh.
And I think that that's like,
But
big
I'll email Dr. Lloyd, say, can you have this happen in Monday?
Cause we
Yeah.
still have to be denied if there's a.
He,
like a-
yeah, there's three
I
more
do know
things,
research.
3 more days of notes that we have not covered.
Yep.
We're
hmm,
gonna get to all.
When are you going
I
to his
don't-
office?
I don't have any more
Just go like.
notes in my
Like right
notebook
now?
from that.
No, yeah.
Can I
Then
go
we
with
have to
you?
talk
You
about,
wanna ask him if he wants to move there now?
I'll talk about it too.
Okay.
I understand the cis and trans things, and I understand the linear graph and how the linear graph proves that, neuroleptics are, direct antagonists, but I don't understand how we use the cis and trans.
Pixel.
To discover that.
Let me read through my notes quickly. I vaguely remember that.
I don't remember.
Yeah.
Unfortunately.
Well, no, sorry, we talked about it
Did
a
you-
bit ago, but.
There's also, maybe
Oh.
remember the 4
it's
different
like.
GABA agonists, so like sex hormones, barbiturates, benzodiazepines, and ethanol.
Yeah.
Are the 4 GABA,
Oh. What?
the 4 GABA agonists,
We talked about that.
benzodiazepines, barbiturates, sex hormones, and ethanol.
Can you repeat that? You write those down.
Sure, I can write it
Like,
down.
was it not booze? Does someone say?
That's what
booze?
ethanol is.
It's booze, okay.
If you write down booze instead, I'm giving this to you.
For what? What are they?
Here, I'm writing it down.
GABA agonists.
Everybody's got it out for gas.
Okay.
NMDA, the type of receptor, what type of receptor is it for?
Glutamate. It's also good to remember that glutamate is neurotoxic. Oh, there's the tonic and the phasic thing that we didn't go through. If you put down the chords for My Lady Carries Dompe, I will give you extra credit for that.
I don't know what that is,
What?
so put it down.
Yeah.
The chord piece. Oh, well,
Oh, yeah. do.
That song
You were-
was so annoying. I hated it. I
you
can
were
do
in-
I can do the love the one or the.
It's
So many
teenager
people
and-
put that song in there as well, but
I think
oh my god, I hated it. It hurt.
Do you feel like glutamate is toxic
it's neurotoxic, yeah.
in like a large amount or?
Yeah.
So like when you have he talks about it specifically with hypoxia. So when you have too little of oxygen, you'll have an increase in glutamate release, which the glutamate then becomes neurotoxic and you have cell death. I sent him an article recently about why you have a release of glutamate in hypoxia. So if he says he doesn't know, he's lying. Or he didn't read the thing I sent him, which he told me to send to him.
So,
Did you guys talked about the withdrawal effects from analgesics?
Like growing up and
Hypogesia, rebound dysphoria, insomnia, hypermotility.
No.
we talked about the side effects of like opiate.
Yeah, it's the same.
Okay.
You guys really should have this test on Monday.
Yeah.
yeah, I'd say
Okay, all three of the TAs say this.
everybody.
Maybe we,
Well,
maybe we should come in Friday to the class period and just run through some of this.
No,
stuff.
don't even give us our exam, be like, actually, guys, this is,
Oh, you
Thursday.
guys don't.
Thursday.
I take class on Friday to learn.
No, come
We'll be
tomorrow.
busy Thursday.
I'll just like
the
the
time.
time.
We have a class at, no, I have a
Yeah.
class at 9 or 12:30.
I don't know, if you guys are around on Friday, I can host another one if it gets moved back. I'd say that
I'm not even. where's my
if you
cis-
guys do kind of ask him for more time, if enough people
cis and
do,
trans
it
fluid
probably,
pixel.
he'll probably say yes. I don't know if Ronald plans to, we do have to kind of get going, so I have to turn this in, sorry.
That's okay.
I don't see anything.
If you guys
It might
have
be on
more
the next one.
questions, send your TAs